Right. So I'm so excited to introduce a new series from the medical doctor's perspective. And I have one of the most amazing doctors in the entire world here today. Her name is Alia Whitman. She is a Fascia Advancement Academy certified fascia blaster. I'm just so excited to let her tell her story, and also just be a witness for all of you, someone that can answer questions, give you the perspective from that medical space. So I think that's probably the first thing we should jump into, Alia. Tell me a little bit about your current / transitioning position and what really made you take the leap.
Yeah, my jump into fascia blasting and the Ashley Black family was a personal journey. My background is in emergency medicine. I've always been granola, and my team has always joked, like, you're a little granola or you do things a little out there. But what became a hobby became very personal when I had a traumatic delivery. That delivery and the recovery from that is what helped me find Ashley Black and fascia blasting, what springboarded into this practice, starting to kind of build the nuts and bolts of what I wanted for patients.
Oh, I love that. It's always a personal thing, right?
Yeah.
It's something that has to happen to us so that we begin to have that passion. I know for me, before I did fascia blasting, I'm flying around on private planes with Leonardo DiCaprio. Everybody got excited to see me, and I traded all of that in for resistance, basically being on the cutting edge. You tell the audience a little bit about you're not just an MD like straight out of school. Like, you
Yeah.
really have been in the trenches as sort of the quarterback, really, for people's health.
Coming from the Cleveland Clinic in emergency medicine, I had a well-established career, and everybody thought I was crazy making this leap of, you're walking away from that salary, that career, that you're already on the track. Why are you walking away from this to nothing, no income? And it was it was very personal. It was like, this is what I genuinely feel called to do and what I genuinely feel like is the path forward for patients. I love emergency medicine, and I think it's still valuable and it has its place. But as I was growing and learning, it was like, how could I not do this? How could I not bring this to patients? And so then I founded Physician Within, which is my company that's functional regenerative medicine. Functional medicine is, how does the body, like, what's the root cause of what's going on? What is actually going on? Not just like, here's the symptom, but let's go below that, maybe even below that, of
Yeah,
what's driving everything. And then regenerative medicine is giving the body what it needs to heal. And that's where I think
right.
fascia blasting falls in. And they really pair together because, you've covered this in several blogs too, of food is medicine. And if you're not feeding your body and healing your gut and doing those things, you can blast all you want, but you can't outrun what's
That's right.
going on at a root level. But if you really pair both, people just get better. And it's amazing to see. It's been so humbling as a physician to see patients get better, and just the hugs and the just thank you. Also, in such a different approach in my practice, because medicine's become a little bit paternalistic in terms of, here's your diagnosis, here's your treatment, take it or leave it.
Mhm.
Where in my practice, patients are able to come in and we spend so much time on education in terms of, here's the way far woo and here's the standard of care. Here's everything in between. Let's find what resonates for you and how you're really going to get better. And talk about, the evidence, the lack of evidence, the safety data, all of that, and then letting patients drive the bus on their own care. That, I think, is what really drives patients getting better, is when they're at the helm of their own care.
Alia, I love that because you and I are both believers,
Hmm.
and I cannot get past physician heal thyself. We can't heal ourselves if we don't do the research and have those spectrums you mentioned. And I feel you're literally almost biblically giving these people a way for
Yeah.
them to be empowered to heal themselves through these various modalities. It's very kind of primordial a little
It
bit.
is, and it's like one of those things too. The hard part about it is our current model is, so all insurances, right? They're there for accidents, like your car insurance, your home insurance, your health insurance. They're not built to be a health model. And
Right.
so that's sick care, where this is what we're trying to do is healthcare and a health model in terms of navigating that and helping people never need their insurance. And then people are like, oh, it's so expensive because their insurance doesn't cover it and it's an investment. But even when you talk about looking at it biblically, like, just look at creation. Start with food, start with water, start with grounding, start with sunlight, start with rest. I mean, you look
Right.
at the days of creation, it's spelled out. That's all free. It's in there. It can be very foundational. And I think, where you and I come in the picture is we're there to coach and we're there to help guide for
Right.
patients that want that and want that hands-on approach.
Right. Absolutely. I love everything that you're doing. And I love that fascia blasting is a piece of it. From the time that you had that delivery, have you just learned about fascia and fascia pain? I love that you call it a root cause, but we both know it goes even deeper than that into kind of that creation. Where all have you gotten your fascia knowledge? And then how impactful has that been on kind of your approach now to treating the whole person?
Post my delivery, I did really well initially, and then I started into this really chronic pain. All of my specialists and people that I adore and respect are like, "You're doing great." And I'm like, "No, I'm not." This isn't, I'm really good at hard things. Give me the checklist. I would go to my appointments and I would say, "Give me the list and I will do it. I'm good at
Yeah.
hard things. If you give me the list, I will check them all off and I'll be better tomorrow." And there's like, hey, there's no checklist. It was so hard for me because I've always been like, follow the protocol, do the thing, type A.
Right.
I will do the hard things. I will get through med school with kids. I will do this. I got this. And then there wasn't a list. In seeking out complementary and alternative treatments and multiple specialty, a multidisciplinary approach to my care, it felt like I was guessing a little bit. And it felt like I was just trying like the next thing of like, okay, this one didn't work. What's this? What's that? Looking at all these different options. And a colleague said to me, oh, because I could feel pain from my surgery on my abdomen all the way up to when I swallowed and to my foot. And I was like, this doesn't make any sense. Like, why can I feel this when I swallow in my foot and my knee and just all the way this I could go. I'm like, I can find you points all the way up. Why is this? He's like, oh, that's the deep anterior fascial plane. And I was like, what is a fascial plane? I've been in medicine now 10 plus years. I've never heard of a fascial line or a fascial plane. Of course I know fascia. It was, in gross anatomy. Here's the fascia, label it, take it off, keep going to the
Right.
muscle and all the next things. And so then that's when I found you, was searching that. Even from that, looking at all of the peer reviewed research that you've done and the other research that you've pulled together in your
Right.
journey, that was sort of all I needed to try it myself. It's one of those things that when you see a study as a patient, it's great, but it's like, what about me? And then when you see a study as a doctor, it's like, okay, well, that, you watch those ultrasound images, you can't really deny, right? And then it's peer reviewed, it's got backing that it's valid. But then when you pair your personal experience with a validated study, that's priceless, right? And so for me, didn't take much for me to say like, oh, I'm going to try this because why not, right? The risk is so low and the
And it's
reward
like
is
can't hurt medicine. Yeah.
right. And it's one of those, okay, so I could have a bruise. So what? But then when I tried it and I started getting better and then found the data and the peer review, all the other things, it made sense. It made too much sense. And so personal experience plus the study, that's what really cemented it for me.
Were you one of those that read every single blog that I had, or were you just, I'm going to go take the class?
I read enough. I want this for patients. How do I pull this in? And, you and I have talked before of I'm not a body worker. I just believe in this. So how do I do this? I know I can watch your how-to video and like figure out for my hip and my back and these things, but how do I bring this to patients? Like, what does this actually look like? Purpose of me coming to that course was to figure out I didn't go to school as a massage therapist to run an hour-long treatment. I don't know how to move through a treatment session of this. I can move through a procedure in the emergency room. I can navigate these care settings, but how do I navigate this in this setting in my office?
Right. Like in a clinical setting.
Yeah, that was why I went through the course. As I went through the course and started offering it in my practice, it was one of those quickly realized that an hour doesn't really cut it. And,
That's
you're like trying to figure out how do I work the whole system and the whole line and all the logistical part of exposing a whole line on somebody. Quickly, what I adapted to is this is an hour session. You spend 20 minutes in red light to get warm. And then we spend 40 minutes educating you on a specific area you want to work on. Achilles tendonitis or, your cellulite in your thighs or face or specific area, back or something. I go through that peer reviewed study with them. I go through tools. I go through the steps of blasting so that because I think patients find it somewhat overwhelming of like, am I doing this right? And so the
oh
whole
yeah.
goal of that appointment is to like know you're doing it right, know the steps. And I tell patients, in this study, the patients did it 5 days a week for 20 minutes. So if you want the 90-day outcome, that's what we're looking at. I'm a mom of 4. I can't do 5 days a week, but if I get 1 day a week this time and I get 3 days and then 5 days, you're still moving the needle, and that's the important part. We're not going for the photo finish, we're going for life.
I love that. Can we just pause right there for a minute? We're not going for the photo finish. If you wanted to, you could.
Yeah.
It's a lifestyle.
It is, and it's one of
Me,
those.
I'm always like, brush your hair, brush your teeth, brush your fascia.
Yeah, it's just one of those things that you just build it into your routine, whether it's in your shower, whether it's in your sauna, whether it's a part of X parts of your day. You just start building it in and find where it fits and find what you need. And there are going to be times where I was completely pain free and I didn't blast as often. And then I slipped or I was carrying my daughter because, sometimes she becomes like a koala baby and you're like holding her constantly. And then it's like suddenly now I'm in a little more pain. Well, then I amp back up and I kind of know my way back out.
I love that. I do. There's an old video where this woman said, I just know that if I get in pain, I can get in the floor of my bedroom and in 20 minutes, I can take myself out of pain. And I think for me, that is my mission, is just to educate and empower. The tools were just kind of like here's a route to make it easier. Because the reality is you could do a lot of this stuff with your hands, or you could do a lot of this stuff with
patients that have like
not
cost
about
prohibitive. I'm like, these are some alternatives of how you can try this just to like jump in. And then when you realize, hey, this works, you can invest in the tools or however you want to do it. A lot of
for
patients,
$65, grab a mini too.
right. And it's like, or I'll tell them like, here, come in the office, try these different tools. I have every tool here. That's the benefit of the business, is that I have every tool I can use for myself here. And I tell them like, put your hands on it, try these, understand how you're actually going to use it. And in those consults with patients, when I talk to them about fascia blasting, I tell them like, you don't really need an appointment with me. I have every patient download the Fascia app, have them read what is fascia 1, 2, 3, and 4 as their homework. And then I tell them, watch the how-to videos. If you need to come back and touch some tools to figure it out, and then you can probably do this on your own. You don't have to make the appointment with me. I'm here if
But
you
don't you
need.
find that they do? It's
They
so funny.
do, yeah.
Even in traditional sort of bodywork setting, it's, oh, they're not going to need me. And the opposite happens. They realize how better they feel. And then, oh, I need to be able to go harder. I can't reach this spot.
Yes.
I really want somebody that knows the techniques at the highest level, et cetera.
The one patient I have, she comes every week, and now she's coming twice a week, getting ready for summer for her legs. She's in my weight loss clinic. She's lost 40 pounds so far, and she's doing it a lot for cellulite and for skin laxity as she loses weight. And so now she's like really amping up, coming twice a week. But she was like, I just can't nugget myself like you can.
Right.
I
Right. We
can't.
have that pain threshold.
Yeah, like what you can
Somebody that
physically do to yourself. And she's like, I know you love me, but this hurts. And then but that's how I know you love me.
Exactly.
So
Can you speak a little bit about that? Not just with fascia blasting, but other modalities that can cause bruising or can cause pain during the treatment. How do we, as let's just call it health industry, how do we like once and for all say, this is good?
well, I tell people your body has to let you in. Pain's a reminder of the trauma. We know fascia and all those adhesions and scar tissue and all that things that you go through in your videos. We all know that that's from trauma or injury or just life, those type of things.
Right.
But your body keeps track of it. Your body keeps score. What you learn in first entry level class is that sometimes you just have to start with brushing. You have to start so light because you just have to let your body realize, hey, I'm here. I'm here to help you. Let your body relax and let you in.
It's such a co-collaboration. It's frustrating for me when people say something out in the public because it's like you have no idea what I teach on a daily basis and really in the academy. In fact,
Right.
most people in the academy, I'm being, hey, peel that back.
Yeah.
Because at the end of the day, our legs could be a forest of thorns, so to speak. So we're not trying to rip out the hedges. We're
Right.
trying to go to that very first layer, and there is some nuance to it. And the body will open for
Yeah,
you.
it does regenerate. The body does heal. And so it's about approaching your body with an amount of respect and amount of grace too, right? Giving yourself grace to realize that you may have a pain threshold and that's okay. Even for like the patient that I see every week, when we first started, I'm barely kind of rubbing the
You're doing
surface
the
and I'm
tap
kind of,
tap with the pro nugget.
yeah. And I'm just like, do. And now I'm like sweating, now it's a workout. It's actually my Apple Watch always reminds me, do you want to record an elliptical workout? Because
And you're like,
we're,
no, just fascia blasting a patient.
yeah, but it's now we're getting so deep, and her body has let us in. It's been a process. It's definitely a process patients can do at home. But I think what's hard is all of these modalities take time. It's hard in the current culture to, one, give yourself the time to care for yourself, and two, to give yourself the grace that it's not going to be immediate.
Such a quick fix society, and fascia just don't roll that way.
No, it doesn't. And really, no healing does, right? Like when
That's
you
right.
think about trauma or therapy or injuries, you take any amount of healing, it takes time. And it's almost like your body's way of humbling you of you don't take time to rest, I will sit you down and make
That's
you.
right. I'll drop you.
Right, and that's what happened with me with my surgery. I was go, 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 having my
Yep.
4th kid, running an emergency room, doing it, quote, all, and then my body was like, "No, shut
Yeah,
down,"
that's
for
the
7 months,
same thing that happens to me. I even think it happened recently with my hip popping out of socket. Like,
right?
hey, you do have a 23-year-old implant. You might want to address that at some point. I want to make sure we get from a doctor's perspective.
Yeah,
You nugget someone consensually
yeah.
and they bruise. So walk us through what you tell them.
So I tell people I have a consent people sign in the beginning. I'm like, "You will bruise." Going into this, I want you to know that eventually, as you get into this, you're gonna have bruising, and I mean, and I'll show them the pictures of when you blasted me and I had, like, purple legs, and it's
Yeah,
just one of those, like, these
that's
are
a fun
my
day.
this is my purple apron, that I have from this, but I got so much better. And so walking patients through of you bruise all the time, you bruise from various things, and you know that like it heals. No, it heals. So let's walk through how it heals. Recently, I've started using the vein serum to help with recovery and bruising. That even in like the last week that I've used it, have noticed significant improvement in bruising. So kudos for
I'm
that
so
product.
excited about that because, it was funny now that it's the vein serum, we were really looking for something that could minimize the bruising because I think there are people that want to go deeper and they want to kind of speed up their process, but don't want to look suspect at the beach,
Right.
So having the ability to do both. And
Yeah.
I love that. It's just a vasorestrictor. That's all it is. It's so simple and it just makes
So,
perfect sense. It's like you
and we,
break up that adhesion, or even if it's a micro adhesion, the blood is like, yay, I can flow, which we want, but a little bit of vasorestriction will kind of keep things from going from the extremes, like no
yeah.
blood to excessive blood to,
Yeah.
a good blood flow through there.
So then I just walk patients through of we can do cryotherapy after to help minimize bruising. You can do cryotherapy at home, how to walk through when to start blasting again. Like you have this purple bruise, but can you blast over it? Again, your body's going to tell you. You're going to know your pain level, all that stuff is going to be your guide. Your body's going to help you if you listen to it to guide you through that. There's not like a magic recipe of 48 hours later you can blast.
Right.
It's again going to be
I find
listening to
that
your body.
everyone wants protocols, and I'm sure you see this with your patients. You are
Yeah.
just reminding me what it was like to do this in a clinical situation. It was
Yeah.
they wanted the piece of paper with
Hmm.
all the answers, and if you read my blogs, every one of them, I'm like, it's science and art.
And that's all of
Got it
medicine
more of
is
like
science and
an
art.
invitation to explore your bruising.
And all of medicine is an art. And when you talk with physicians that have been in practice 50 years, the difference between them and someone that's in practice a year is the art. And they're
That's right.
touching 1,000 lives or 10,000 or who knows how many lives. And you get the sort of gestalt, you can see it when they walk through the door because you've just pattern recognition and seen it do it enough. And that's the benefit of experience in medicine is that art that you only get with time. And I think the hard part is there's often pushback when something is art or seems like there isn't a clear cut protocol. But when we look at it, there's so much of medicine that is that way. And it's
Yeah.
like
I mean,
we
honestly,
embrace that.
even in emergency, we're guessing. We have tests and we have things that can at least lead us down the path. But let's talk about this because I think that you and I totally feel this way. I think there's a lot of people in medicine, various forms of it, and I mean the woo-woo people too, that
Yeah.
think that we have it figured out, and we don't. We don't know anything. Like I'll give you one perfect example and you can just kind of piggyback on that. When we look at somebody who has multiple sclerosis, for instance, the diagnosis is what? Lesions on the brain. Okay, well, we know that the lesions are not on the brain matter. It doesn't even have the ability to have adhesions or lesions. Again, the words there. It's in the fascia of the brain. For me, if we have people who specialize in multiple sclerosis, but they don't understand fascia and they don't understand how it can remodel in a place that you're not palpating, kind of like what you were saying with your stomach and your throat, then that means we don't know anything.
One of those, I think the hardest part in the current culture of medicine, right, is one, it's gotten very politicalized. One, there's so much wrapped into it between insurance, money, politics, all of that. And also this clamor of information is changing so fast. The hardest thing in my practice right now is that every day I have a new modality or a new something that somebody wants to offer me to offer at my practice, invest in.
Oh, I
Hardest
bet. I
part,
bet you're getting the sound beds, every new
everything, right?
the
And so it's like,
robotic massage.
reining in of like, here's where we're going to start and here's what the roadmap could be. Medicine as a whole in the past, it took on average about 17 years for something to come to the standard of care. The hard part is right now, with the way things are so rapidly evolving in all industries, people want that yesterday. They don't want
Yeah.
to wait for the cure for MS for 17 years to become the standard of care. And they're willing to take risks. They're willing to try things. They're willing to look at things. That's kind of where I think as a physician, we come in to be that education, to be that person who's patients that come in with something and they're like, have you ever heard of this? I'm like, no, I haven't, but I'll look it up. I'll research it. I'll figure it out. I'll help you make a plan. I'll tell you where the safety is, where the data is, and where the data isn't. I can just give you what we have, and then you can make a good decision for you. And I
Yeah.
think what's hard is all of those specialists of whatever different things is it's been so ingrained in us of the standard of care, the medical legal implications of the standard of care and your peers, the implications
It's almost
of,
like physicians are in handcuffs in some
yes,
kind of ways, right?
yes.
Because
And
I
wait,
always find people want to like pit me against doctors. It's like my
right.
way or the doctor's way. And I'm like, I have so many doctor friends and we have open conversations about this. And there's so many people that are like, I would love if that were the way that we could operate.
And it's one of those, how do we merge the sciences of both and really start looking at those? As you know, how long did it take you to do that peer reviewed study?
Oh my gosh. I mean, you had to cast it, you
Right.
had to sign it, you had to do it. And then we were over 3 years in review.
So you think about to get something to standard of care and validate it and pull all those, that whole spectrum from what you've done to what they know. And it just takes so much time. Part of it is the public doesn't have the patience for the time. And the physicians genuinely, I mean, 99.9% of my colleagues genuinely want patients to get better today as fast as possible, whatever. And like you said, they're handcuffed or they're trying to do it safely and they're trying to navigate what is safety and what does that look like?
You're right, though. It's just moving so fast. It's wild what's happening in medicine. What are you
Right.
seeing? Like with you making the shift, I know probably immediately you were the crazy person like me. So how are people reacting now that your practice is off the ground? You're having, no one can deny results. Has there been
So
a shift or?
I think there's a combination of a lot of people are like watching. Is this really the way? Is she going to be successful? How is she going to do this? I think there's still a lot of people that are that are friends or people that colleagues that are just still silent of like, oh, she's crazy, and they just don't say, they just don't say it. I haven't gotten a ton of backlash per se, but I think it's just because hey, I want to talk about it, and
Yeah.
I'm also very vulnerably willing to say, you're right, I don't know. And
I always felt like I was that person too. Even though I came from a non-medical perspective, for people's health, a lot of time I was kind of like the bullshit meter. You know what I
yeah,
mean? Where
yeah,
it's like, hey, that doesn't make sense with this doesn't make sense. But I always, like you, was trying to I would always say, I want for you what you want for you. Go this route. It's going to cost this much and it's an unknown.
mhm,
Or I could tell people I've done this 1,000 times. It's going to be $500. I'm gonna get you in and out of here in 3 visits as long as you do everything I tell you to do, kind of a thing.
right, yeah.
I mean, we can't remove the practitioner. I think that's why it was so important for me to do the academy. And even with selling the products company at some point, it's important that I retain the academy because even I am learning every single day. And it's because other people have jumped on the fascia bandwagon and now they're doing their own research.
Right,
And I mean, there's peer-reviewed research coming out all the time now about
right,
fascia. Let me ask
right.
you this, it's just a real like simple question, but how important do you think fascia is compared compared to the cells, which
I
is
mean,
pretty much everything we think is the body.
I think what's hard is that we underestimate. We always sang the song as kids, the elbow is connected to you like, everyone knows that song, right? But what we've been singing about that whole time is fascia. That we
Right.
didn't know that when, I didn't know that 30 or 40 years ago when you singing those songs. But the reality is it's so interconnected, and this is the interplay. It's like when you want to try to talk about chicken or egg, like, is it the cell or is it the fascia? Is it the health, whatever? You can't have one without the other. It's
Right.
like,
And even when I think about the cell, this is the download that led me to, like, I was like the accountant on
yeah,
whiteboards. When you look at it and you see in every biology textbook that the mitochondria is floating in matrix, how can we say it's outside the cell and inside it's both? I think the fascia is transcending in there, and everything that we think about powering up the mitochondria, it's just other names. So when they say, oh, the RNA travels on the microtubule or one
yeah,
tubules,
all the
it's
things.
like,
Yeah.
the fascia.
I can't wait to see where it goes. You and I both have said, like, you can't argue with my experience with it. You might argue with how the science works or the details or you want to get it on an Excel sheet so that it exactly fits how you want a model or protocol. But the reality, like, for me, I need that it works. And I'm totally fine with someone else figuring out why or how.
Me too.
I know that I can bring patients a way for them to do. It doesn't require the terms of investment and the amount of things that people need to do. This is one of those things that I can confidently be like, this you can do totally on your own. And outside of your investment in your tools, it's completely free.
Right. Feel like I'm talking about kind of like your God-given place in the whole fascia universe. I feel like I am the one that, how do you feel?
I feel I'm the one that's here to help people trust themselves,
Mm.
trust their body again, and heal,
Mm.
and to look at it from a much broader perspective. I don't care that you believe what I believe in terms of your faith. If you want to know what I believe, I will hands down tell you where my story, my testimony, what I believe, why I believe it. But undeniably, you're a spiritual being, and you can't have full health without considering that part of your health. And so I'm going to at least ask you about it in terms of your functional health. And we look at your spiritual, your mental, your physical health. I'm not just going to leave that out of there. We're at least going to talk about it. Again, it's your health, it's your body, it's your spiritual decisions. So you get to guide the bus as to how much we talk about it, how we pull it in, how
Right.
important it is. But I'm not going to just like ignore it.
Right. It was funny when you were talking about the microbiome. I always tell people, thinking of a personal friend the other day, oh, I'm considering doing a surgery, right? And I said, okay, I don't have any issue with surgery. I know how to help you with the scar tissue if you
Yeah.
decide to do it. And I know how to help you detox from your anesthesia. However, I would never even consider a surgery until I was at baseline. And what does baseline mean to me? It's probably something similar to you. Number one, is my microbiome kicking it? Am I sleeping well? Am I happy right now? Am I fascia blasting? Am I exercising? Am I getting sunlight? Until you have done, to me, the bare bones basics, and spiritualism all wraps up to me in that happiness. I mean, it
Yeah.
is what says happy, right?
Like, I have people that also ask me, like, well, what is your stance on Botox, or what is your stance on vaccines, or what is your stance on, any controversial thing? And I'm like, if we get down to that, the last thing that you need to work on is Botox, and you've nailed sleep, you've nailed getting sunlight and grounding, you've nailed your diet, you've nailed
Fascia
all you
blasting like a
yeah,
maniac.
yeah, like, you've nailed all these things, and we get down to Botox, like, you're doing great. Like, if that's the last thing we have to
And
worry
I'll be
about.
the first one to
Yeah, one of those, if that's the last thing, then sure. But if it's one of those, if we optimize all the other things, some of these modalities all kind of become, they work, and they work in a way that's your body's resilient and can tolerate it.
That's
And
right.
so my goal in my practice to make people metabolically flexible, cellular health and fascia health, and spiritually healthy, of whatever that looks like to them. That you can't shortcut it, and it's going to take time, but I want to be your guide and help be your coach in terms of getting you there.
I love that, Alia, because people come to you with, like you said, Achilles tendonitis, I don't know, repetitive motion, shoulder
Injury, yeah.
injury or whatever. And you're there with your PRP, and you're there. I feel like no matter what someone comes to me, or fascia blasting, even if it's out in the internet world, for me, it's always about having them come into the Ashley Black freak world, because these are long term, all the things that really have to line up. And I don't care if the bait is cellulite or if the bait
Right.
is a headache or whatever. I guess that's probably similar.
And I tell people it's probably a poor business move that I don't just charge you for PRP and send you on your way. But what if we made a plan that you don't need PRP? You could come back and need PRP every month or every 3 to 6 months or every year or whatever, and I could send you on your way. And that's a great business model in terms of revenue. But what if I actually help you heal and you don't need it? Right? What if we address all of it? And some
I
people
feel
want it and
like
other
too,
people
from
don't.
a business model, it's all about when we're authentic, that the money follows. I also feel like so many more people are saying, you know what, no, I'm not going to get a third car. I'm going to put that money towards my health, and I'm going to put a little room in my house with all my, can I just tell you, I've owned hot tubs, saunas, infrared, oxygen chambers, cold plunges for a good decade. And now all of a sudden, this is like something that's being offered. So I'm feeling hopeful. How are you feeling about people being willing to pay for their
I
care?
mean, I think the biggest thing that I get from feedback for patients is this is the first time I felt hope that I could get better,
Ugh,
right? And it crushes you, but also is just so rewarding to like have someone say, I have hope, or 3 or 6 months, they're like, I feel amazing. I didn't know I could feel this good, or those type of things. And I think that's the one of the things that's missing in medicine is the reciprocity of relationships, right? And it's hard in a big global system to have that ability to connect and have that give and take of just the human relationship between patients. And what I love about my small practice is that I got that back. And that hope is almost the payment is that I just that fills my cup. I walk away every day. Man, I get to do this job. I had the best day ever. I was thinking about it actually driving to work today, knowing we were going to talk about stuff of like, I don't think I've had a bad day at work. And since I started, I've had stressful days navigating being an entrepreneur. I didn't go to school to be an entrepreneur, but I'm figuring it out as I go, but I haven't had a bad day from patients or from the medicine side of it.
right.
And
It's
man,
such a collaboration, and Alia, I feel like doctors sometimes get put into a box for the reasons we were talking about earlier. But, my experience with my own doctors is that they are collaborative, and they will take a text message late at night, and they will listen to me. I haven't had a real health problem in years. And when my hip went out of socket, I had an integrative medicine doctor in San Jose that helped me with my microbiome. And I called him up and I'm in a scary situation and I'm not really know what to do. And he just came in and it's like, this guy went to school with me. And, when I
yeah.
got on the plane, I had an anesthesiologist. I was met with, this orthopedic surgeon pretty much at the door of the hospital. For sure, it was collaborative. Everybody was asking me like, well, what's the protocol now? And no, it was a discussion with me and my doctors, so I don't want MDs to like get the bad rap from the holistic people. We really do all want the same things.
And I think too, just to start integrating, and one of my mentors is a naturopath. One of my people that I meet with is a chiropractor. They are all these different modalities and they've just learned what I've learned from a different way. And so it's one of those, their schooling's different, their perspective's different. And by taking it all in and hearing their perspective, it's helped me make my own practice that's maybe different or maybe the same from theirs, just being able to pull in all those things. And like you said, to be able to have that conversation with people that you don't necessarily agree with or don't have the same training with to broaden your horizon and to consider alternatives.
Why do you think that doesn't happen in the system? I mean, I literally, like, I call people normies
Yeah.
and I don't know what to do with normies because like, I'm just so open to information. So do you think that that's just a normal thing that, someone is trained this way and they do the thing and they do this way? And we just need a raise in consciousness in the whole wide world? Or do you think there's something specific that kind of keeps these sectors of health apart from each other? I always looked at it like I'd love to have a panel with an ER doctor, a functional medicine doctor, a chiropractor, a traditional medicine doctor, and then I'd go off the rails and go find me indigenous ayahuasca
Shaman.
facilitator. Yeah, get the shamans involved, the yoga instructor, the
Yeah.
relationship expert. It would look like half ZZ Top and half white coat, probably. Imagine if we could all collaborate. Like, I wonder what it is that really keeps our world from doing that. And
I
are
mean,
we headed in that direction? I hope so.
I sure hope so. I think that there slowly are enough people headed towards hope. I think it goes back, as believers, it's so foundational. It goes back to fear and feelings versus facts and wisdom, right? And so when I was a medical director and people would come to me with all these different things, I'm like, okay, let's separate the facts and the feelings. Like there's a lot of feelings going on about all of this. But let's separate to the facts and then let's try to be critical and think about the facts from different perspectives, or from their perspective, your perspective, or, what's an alternative thought process that might serve us better. And I
Yeah.
think when you can kind of take the fear mongering, you and I could get on here and do a bunch of fear mongering, right?
Oh,
But
sure.
when we take the fear part out of it and we try to just stick with facts, hope, and you and I have talked about this before of I'm not here to bash someone else. I'm just here to be different and be myself. And I don't have
And I
to,
always say, I don't need to step on anybody to get where I'm going.
right? Like I don't need
And in
to
fact, I
bash
have so
anyone
much
else.
energy. Come with me. You're all welcome.
Right. Yeah. And it's like, I don't have to bash or do anything negative from fear perspective, from feelings, from any of that, to just be different and just do different. And if people want different, they'll find me. If they don't want different, they can do
Right.
whatever they want.
And, when the student is ready, the teacher arrives. And I just kind of feel that way. When somebody's not at my level of consciousness or doesn't align with what I'm talking, I'm not here to convince anybody of shit.
Yeah. Well, it's like it comes kind of back to like the Mel Robbins and let them. Like I'm just like, okay,
Let them.
let them, and that it's so simple, but the reason why she's so successful is it's so true. To be able to embrace that is hard though, because we do crave relationships, we do crave approval, we do crave that because we're built to be connected. We're created for connection. And so it's about that balance of being yourself and being authentic, letting people and still connecting. You can let somebody be or who do what they want, but still find authentic connection.
So if we had a viewer out there that felt hopeless, which I know was me as a patient, I had no answers whatsoever. Role play with me, and I'm going to tell you I'm injured. I'm going to tell you some things that I hear. I have fibromyalgia. I'm taking 8 different medications. I have depression. I've gained 50 pounds in 5 years, and I just have tried everything. I go to the gym. I did all this stuff. I took all these supplements, injections, blah, 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 blah. I am just sort of over it.
A lot of time for that patient, it's actually making it really simple. You are working yourself so hard that you have triggered your fight or flight and you're living there instead of allowing your body to rest and recover. And so we're going to make your workout resting and recovering, vagal nerve stimulation, grounding, all these things that we are not good at doing in today's society. I'm going to build your plan that this is your workout. You have to change your thinking towards what's good and again, we're really good at doing hard things. And we just think, oh, I have to try harder. And it's almost, no, you've tried so hard for so long. Let's make it easy. Let's start really simple. Like, let's focus on sleep, water, your diet. Start there. And it becomes
Love
so
that.
foundational.
I had one woman come into my group and she was just hell bent on, she didn't have time. She was too in pain. Like that, she had every reason why she could not fascia blast for 3 minutes. It was so great because my whole group was like kind of coaching her. And I said, look, Ken, for 1 week, you just get your water intake. And she was finally, yes, I can do that. And I'm happy to say that even through a Facebook group and being counseled by 500,000 women,
Right.
she eventually became a fascia blaster, and I hope she is well on her way. Sometimes fascia blasting, because it is so easy and cheap, it's just the catalyst. It's a
Yeah,
very
it's
powerful
just
catalyst.
it's like the domino, right? The dominoes can start falling this way or they can start falling the other way. And sometimes an intervention like fascia blasting or water or something is just enough to switch that inertia to start. And it may be slow, like the dominoes may be spaced really far apart and it may be super slow, but to just start feeling that current go the other way too is, I think, just where people get hope, right? Because they can feel that change in their body. And then when your body starts to change, you start to feel better. You start to get those good neurotransmitters that then allows you to make better decisions because
That's
it
right.
just, it so quickly can then pick up steam and become a whole lifestyle of food, movement, fascia block. I mean, it just, and then it's suddenly like people will say, and I'll tell patients, like, you're going to look back a year from now and not believe where we've come. Just give yourself the space of the next 3 to 6 months or a year, and we're going to look back and you're going to think like, I can't believe this is where I'm at.
That's so true. Well, I have enjoyed our hour. I hope my viewers have. We're going to put this in segments on social media, but we'll put the episodes in their entirety on YouTube. But this is so exciting because Dr. Whitman has agreed to do this on a regular basis. So I thought what would be really fun is for you guys, our audience, to start to ask some questions. Like give
Yeah,
us
how can we help?
questions, or give us your disease that you just can't fix, or you had this injury and it never got better. What other things do we want to
Yeah. What other
solve?
questions you have that we can help? It's more, I think it's building that community of help, and just continuing to feed forward because we were so blessed by it and to just, excited to be able to pay it forward.
Yeah, 100%. And my big thing now, I have such a beautiful healing community here in Costa Rica. And I have a good friend with cancer. And she was like, I just need my community. I just need to heal in my community. So I love this idea of, being able to pull in a medical doctor and maybe some other perspectives, and my perspective, which is kind of straight up fascia based, right? And let us kind of come in and give you that perspective hug along with other people who've experienced that. I think that could be really, really healing.
Yeah, I think too, like, who else do they want to join us? Like, what other perspectives they want with us?
Oh, that's a great question. So we've got the
Because
medical doctor, we've got the fascia expert. Who's
who else
next
do they
that
want
we
to hear
bring
from?
into this
Who do we
panel?
want to bring into the fold? Because I
Yeah.
think the commonality is that we have a heart for healing, right? And so who else can we bring in? Or, again, we have a heart for healing. So what other questions do you have for us?
We'll leave it with that. We'll put the instructions in the various posts. Then we'll see you on our next episode. And thank you so much. You are a mother of four and an ER doctor and have your own practice. So I know it is important to you to touch more people. And I'm just really blessed to have you spend an hour with me. And I'm sure what you said is going to resonate with so many of my audience.
Equally blessed. Thank you for your time as well.